Hi, everyone. Tonight, we're going to talk about changing the approach to concussions through education and proper treatment. First of all, just a little bit about myself. I'm a chiropractor who's been in practice for over 28 years. I've been specifically involved in concussion management over the last 15 years, predominantly because I have a lot of athletes in my practice, and concussion was becoming a very prevalent, prominent, and common thing. I sought to start managing it properly within my practice. Back when I started, the primary mode of testing and evaluation was a test called impact test. Impact test, I think, still remains to be the largest and most commonly used cognitive computer test in North America, certainly within professional sports. I'm a certified impact clinical consultant, and I'm also a featured speaker on impact test applications clinical continuing education program for other doctors. More recently, I'm a member of the Complete Concussion Management Clinical Network. That network is easily the largest clinical network within North America and probably worldwide. And it brings a lot of value for concussion management. One, because what we've done is there's a large group of clinics and clinicians across North America, and as I said, across the world, and we all have an agreed upon standard of practice with regards to concussion management, baseline testing, and evaluation. And so you're assured if you go into a CCMI clinic, you're going to get the same standard of care regardless of which clinic you go to. As I said, I'm a licensed chiropractor and AK practitioner, and over that 15 years, I've probably performed a little over 3,000 cognitive baseline tests on amateur and professional athletes, as well as managed concussions, probably a few hundred in that time. And when I say managed, I don't mean just bringing Johnny or Bobby into the clinic and how you doing, and okay, we'll see in a month. I mean actually treating them with a goal to get them returned to play safely, faster, and objectively. So what is a concussion? That's one of the primary things we'll talk about tonight, as well as what to expect and look for as a parent. Associated risks with concussion, red flags to look for with concussion, prevention strategies, preventing long-term problems associated with concussion, what to do after your son has had a concussion, and baseline testing. And finally, because tonight everyone involved has a son playing North American football, we'll talk about chronic traumatic encephalitis, CTE, because that's a prevalent topic with regards to concussion, especially in football. So concussions and issues with concussion in sports. First of all, concussions are the most prevalent injury in sport and can have serious impact on a developing brain. So when we're talking about amateur, young athletes, it's a critical issue to talk about and learn about. Up to 30% of high-risk athletes receive a concussion each season. And 50% of concussions, it's estimated, in sports are not even recognized or reported. So that brings into question, is that 30% not actually a lot higher? Research shows that one concussion is not associated with any serious long-term impact. However, a second concussion prior to full recovery from the first one has shown to cause potentially permanent or even fatal brain damage, and that's one of the key things we'll talk about tonight. Now, this means the concussions are not necessarily the problem. The current issue is the improper management of concussions. And in fact, concussions are treatable and often result in full recovery. Mismanaged concussions, as I said, can cause permanent or long-lasting issues. Despite the prevalence of these injuries, most healthcare practitioners do not have specific concussion training, and the topic is not generally covered in medical or allied healthcare curriculums. And one of the problems is, in fairness, if a practitioner is not seeing and dealing with concussions on a regular basis, this field is constantly changing. I'm not doing the same thing in my practice that I was doing 15 years ago. And as I said, concussion management is not extensively covered in any medical or allied health curriculums. So what is a concussion? It's a temporary energy deficit in the brain. There is no structural damage. It is not a bruised brain. What it is a functional injury in how the brain is functioning. So let's look at the brain specifically. So if we were to take a cross section here of the brain, this is what we're going to generally see depending on where you take the cross section. Everyone has heard of the terms white and gray matter. Gray matter is the outer dark layer. White matter is the fatty tissue within the gray matter, and specifically where the nerve cells are. So the nerve cell, the neuron, which is in the white and gray matter, the cell body of the neuron is within the gray matter. The axon is within the white matter, and then the axonal terminal, which goes and communicates with the next nerve cell, whether that be in the brain or in the spinal cord. The thing is that the white matter and gray matter have a different consistency. Their densities are different as far as the tissue. And so when we have a brain injury, those densities move, decelerate, accelerate at different speeds and rates. And that causes problems here with the with the neuron, whose different parts are in different densities. So normally, here's again a picture of that nerve cell. The cell body within the gray matter, the axon within the fatty component, the white matter. And these nodes here is where a signal is perpetuated and travels down the axon to the next nerve. And a signal is something called an action potential. It's an electrical impulse. And what happens is at these nodes, there's an exchange of ions. They're like a gate. So when a signal is perpetuated, these gates open, certain ions leave the cell and certain other ions come back in, and that causes a depolarization electrical charge, and that electrical charge then travels down the axon in a time of milliseconds. So what happens when that signal is perpetuated is there's a small, what we call refractory period, once a signal is passed on, where these ions need to rebalance themselves within the cell. And during that time, a cell can't fire or perpetuate a new signal rather. And this period only typically lasts like 1 millisecond. So it's very temporary. So in a concussion, what happens is when the skull impacts, or if the neck is whipped back in a whiplash situation, the brain inside, because it's a different consistency and it's primarily fluid, encased in fluid, is that shock or deceleration, acceleration of the brain kind of travels like a wave through the brain tissue. And that causes because these different components are different consistencies, it causes a stretching or pulling or shearing of the actual nerve cell. And what that causes is then multiple action potentials to happen all at the same time. Because in all these nodes, all of a sudden, in all these nerves, that stretching or shearing causes a rapid depolarization or exchange of ions all at once. And because there's millions of cells all firing at the same time, it causes a huge refractory period, and it causes an imbalance of ions within the cell that can immediately reset itself. And so this refractory period becomes very much extended due to this imbalance of ions, and this creates a period of vulnerability in the cell. So essentially what happens is all of a sudden, all at once, all these cells fire at the same time. Essentially, think of it like it creates an electrical storm within the brain. So during this electrical storm, there's a period of vulnerability where we have a huge drop in energy in the brain, in all the cells. That combined with the drop in blood flow, because we're trying to restrict, or the brain instinctively restricts with an injury, any swelling, because that will create problems in the brain. That leads to imbalances in energy levels as far as getting more energy into the cell. It causes a huge metabolic problem inside the cell, and it takes time for that to normalize, often many days. It varies between injury and people. Sex, age makes a difference, and obviously the severity of the injury. What kind of hit constitutes or creates a concussion? Well, first of all, good news for you. Less than 1% of all football hits actually create enough force to generate a concussion. The force required for a concussion is estimated to be between 70 and 120 Gs in adult males. Now, granted, that is much less in children, and it's also less in women. To give you an idea, if you were in a car and you lost control and you went into the ditch and hit a telephone pole at 60 kilometers an hour, that would roughly generate about a 70 Gs of force. So it gives you an idea, it's a fairly substantial hit. Now, in neck injuries or whiplash, the force required is only 4.5 Gs, much, much less than what's required in a concussion. The point being that both concussion and whiplash have similar, if not the same, symptoms. And if you're going to get a concussion, you're almost guaranteed to get a neck injury. But again, both have the same symptoms. So sometimes it's a problem determining whether you actually have a neck injury or whether you actually have a brain injury. As I said, it's almost guaranteed that if there's a concussion, there's some level of whiplash injury, neck injury. Also to note, whiplash is the primary mechanism for concussion, the most common cause, not actually direct impact to the head, because the whiplash creates that acceleration, deceleration of the skull. And if the force is enough, it creates significant acceleration, deceleration of the brain. So how do we diagnose a concussion? First of all, you need to understand no tests currently exist to diagnose a concussion. So while we'll talk about this in a moment, CAT scans, MRIs, other medical tests are completely useless when it comes to diagnosing a concussion. There are actually two things that are recognized clinically that are required for the diagnosis of a concussion. One is the mechanism of injury, and two is one symptom. Now, a concussion, how long will it last? Well, 60 to 70% of concussions are estimated to resolve within 30 days or less. And again, that might vary. Certainly for adult athletes, it is usually less than 30 days. Hence why you can't compare, a professional football player who's 32 to your son who's 16. Your son at 16 still has a developing brain. The adult at 32 has a fully developed brain. That's one of the primary reasons we believe it makes such a difference. But what's not necessarily understood and is perhaps misunderstood is the expectation that it will resolve. And in fact, 30 to 40% of concussions last beyond 30 days. And that beyond 30 days is a big variation. We could be talking months or we could be talking years, depending on the situation. So as we'll talk about tonight, one of the goals is how do we make sure when you have a concussion, you're not in this group? So what are the risks for prolonged recovery? The first and most important one to talk about is continuing to play. The most important thing that parents, coaches can do if there is a suspected concussion in a game is take that athlete out of the game. It doesn't matter how important the game is. It doesn't matter the consequences of the game. What matters is the health and future of the athlete. It will not make a difference to whether they're drafted, and it likely will not make any difference to their life in general. I can confirm that from talking to both OHL in hockey and professional GMs in hockey. That one game is not going to decide whether they're drafted. Most importantly, is that most athletes, regardless of the sport we're talking about, will never become professional athletes. They're going to become normal people with a normal career and hopefully normal families. So getting them out of play and avoiding these prolonged risks, that's the most important thing. Second thing to prolong risk for prolonged recovery is a time delay beginning treatment. We're going to talk about this later, but there's a plethora of research right now showing that earlier treatment intervention is one of the key things to resolving a concussion faster. In line with that, resting too long. That then delays beginning treatment because one of the key things for treatment is actually active exercise and rehab. I've outlined in these things the red for things that you can actually actively change and do about. Pre-existing mental health condition is another risk factor for prolonged recovery. That includes a family history. Initial symptom severity. So if there's a huge number of symptoms, that's why we take a symptom survey at the beginning of care, is also an indicator, potential indicator of a risk for a prolonged recovery. A high level of pre-existing inflammation. The reason why I have that on is because that then directly leads to lifestyle. Now that may come down to educating both parents and athletes about the importance of their diet, about their importance of sleeping. Tell your son that if he's not getting good rest before his game the next day, one, he's not going to play well. But if he gets hit and injured, his risk of a concussion is going to be higher. Binocular vision issues. An athlete might have 20/20 vision, but binocular vision is the way functionally the eyes visually process and take in information. That can, again, be evaluated ahead of time. And there's exercises, treatment, actions that can be taken to mitigate binocular vision issues, which I'll add has tremendous potential benefit for school performance and education. And finally, being female, which maybe is not relevant to tonight's talk, but that's just a reality that female athletes tend to have a higher risk for prolonged recovery. Signs of a concussion. So parents, here's something you can look for in a game as a sign that that play or that injury or that incident may have resulted and your son have a concussion. One, if they're knocked out for any length of time, they're guaranteed to have a concussion. And I'll emphasize that doesn't mean they have to be knocked out. Less than 10% of loss of consciousness incidents, that results, concussions amount for less than 10% of them having an occurrence with loss of consciousness. Over 90%, there is no loss of consciousness. But if there is, for sure you have a concussion. If the athlete is lying motionless after the play, high probability there's a concussion. If there's motor incoordination after the play, there's a concussion. Tonic posture, often called fencer stance, which is when they're holding one arm straight up in the air. Sometimes they can be holding both arms up in the air. You'll see this especially in hard football hits. An athlete falls back on their back and they're holding one or both hands straight up in the air. You see it sometimes also in fighters when they hold their fighting posture as they drop down. A fifth thing, no protective action. They just fall to the ground. They don't try to brace their fall or roll out of their fall. They just drop. After the incident, having a blank or vacant look, even for a short period. If there's a seizure, there's been a concussion. That doesn't mean every concussion involves a seizure. What it means is if there's a seizure, there's no question. If there's amnesia, there's a concussion that's occurred. So all these things are not the only things that result in concussion. There's plenty of concussions that don't have one or more of these things. But if these things are seen on the field, there's no question. Your son has a concussion. Red flags. When should you go to emergency? It's debated about whether the incident should be 1 or 2 incidents of vomiting. We generally, within this clinical network, say that if there's 1 incidence of vomiting, don't guess, just go to emerge, get them checked out. The reason why they're going to emerge, by the way, is not to have a diagnosis of a concussion made. The reason why they're going to emerge is because what can also happen with a concussion is that you can create a skull fracture. You can create a small bleed within the brain where now blood starts to pool inside the skull. And that starts to create pressure, which can lead to damage, permanent damage, and death to the athlete. So these red flags are reasons why you need to go to emerge to ensure that there's not a more serious injury than a concussion which has occurred. So again, if you've had a loss of consciousness, best to go to surgery and make sure there's not something more serious happening. This is why and when the emergency doctor will take a CAT scan or an MRI. They want to figure out if any of these things have occurred, either a fracture to the neck, a fracture to the skull, or orbital bones, facial bones, a bleed or any rupture of blood vessels within the skull or the neck. If there's persistent anterograde amnesia. So it's very common after concussion that they might not remember the few minutes afterwards, right? Typically even up to 30 minutes afterwards. But if on through the next 2-3 hours, they're not developing new memories. Why are we at the hospital? What's going on? Why are we here? That's a signal. Or why are we at home? When did we get home? What's been going on? If they're not forming new memories after at least 30 minutes, then that's persistent anterograde amnesia, get to emerge. If there's any fluid from the ears or nose, specifically we're looking for cerebrospinal fluid or blood, and this does not look like normal nasal discharge, like if they've got a cold or a runny nose from allergies. Retrograde amnesia, which is beyond 30 minutes. Again, it's very common within a concussion. An athlete might not remember up to 30 minutes before the incident. So they might not remember the immediate times right before they got hit, but they should still be remembering the beginning of the game, assuming this didn't occur at the beginning of the game. They should still be remembering in the locker room beforehand. They should still be remembering the earlier part of the day. If not, get them to emerge. If they have two black eyes, get them to emerge. It's typically called raccoon eyes or raccoon sign, and it's typically a sign that there's a facial fracture specifically around the eye sockets. If there's any visible head or neck trauma, get them to emerge. Bruising, a welt on the side of their head, visible head or neck trauma, regardless of what you see in MMA or boxing, when a guy's got a weltness, get them to emerge. It's very common within concussion that you might see a difference in the pupil size between the right and left, even up to 1 hour. But if that difference in pupil size is maintained beyond that, get them to emerge. In the end, parents, if you have any doubt, concern, or worry about your son, get them to emerge. Have them checked out, have an ER doctor examine them, ensure that nothing else more serious is going on. And then that ER doctor is not there to diagnose a concussion or direct you as far as what needs to be done next. Their job is to make sure something hasn't happened that's going to kill or permanently disable your son. If there's a seizure, get them to emerge. And if there's progressive altered mental state. So one of the things we talk about, it used to be said, don't let the athlete sleep that night. I don't agree with that. It's a brain injury. The brain and the body heals by sleeping. But what I would suggest is for at least 2, if not maybe 3 hours post-injury, don't let them sleep. Keep them awake. Don't let them go to sleep. Keep an eye on how they're behaving. Look for any of these things slowly starting to occur, including if you notice a progressive, altered, or deterioration in their mental state. Not an improving mental state, I mean a deterioration in mental state. So let them go to bed at night, let them sleep through the night. It's probably a good idea to go in and check on them, but not wake them up unless you notice they're in distress. But post-injury, don't let them sleep for 3 hours. Monitor them, see how they're doing. If there's been none of these things showing up, then let them go to sleep, because they're very likely going to be extremely tired with that drop in energy. Symptoms of a concussion, different than signs or red flags. These are the common symptoms that athletes are going to complain about after concussion. And this is in our concussion tracker app and in the sideline test. This is part of what's called the SCAT-5 test. It's all the typical symptoms, and it rates them from 0 to 6. And so these are common things that your son is going to complain about post-concussion. Not all. It might only be one. Typically, it'll be a few of them, but we're not saying it has to be all of them, but any of these are typical with concussion. So what can we do to prevent concussions? Can we stop them from happening? So there's a number of different concepts of prevention: primary, secondary, and tertiary prevention strategies. Let's talk about the primary prevention strategies. Rule changes is one of the biggest. So Hockey Canada eliminated contact in certain age levels in all both boy and girl. Well, actually girls has always been non-contact, but in boys hockey, no contact up to a certain age level. Unfortunately, that's resulted in no statistical difference in the number of concussions occurring. Similarly, USA Soccer banned or stopped heading up to a certain age group. But again, statistically, that's resulted in no change in the incidence and number of concussions occurring. The NFL has specifically implemented multiple rule changes over the last decade, as is amateur football, creating rule changes to minimize the types of hits, for example, head hits. Unfortunately, again, that has resulted in no changes to the number or incidence of concussions. Now, I want to emphasize something here. I'm not saying it's a bad idea to eliminate contact from younger players. I think it's a great idea. And it's a great idea, for example, you parents are involved with Anthony in dealing with skills. Because a younger athlete, what they need to be focused on more than running or taking out their opponent is learning skills. In football, there's a skill to covering receivers. There's a skill and a technique to running a route. You don't just run out and catch a ball. There's actually a skill to it to make sure you run a route properly. Skills to blocking, skills to tackling. Learning and focusing on that stuff is really critical. So I'm not saying any of this stuff is a bad idea. What I'm saying is it's making no difference to preventing concussions from happening. Laws, both in the US and Canada, have been implemented. We have Rowan's Law in Canada. I don't know how many people are aware of Rowan's Law, but there's now laws requiring to do most of the stuff I'm talking about. Unfortunately, most of that was lost with the pandemic. And hopefully we can get focused on trying to, this is one of the goals of why I'm doing talks like this, and other colleagues like myself are doing talks like this to try and bring awareness. We need to get going on this stuff. So one thing about these laws, and many of these things you're going to find listed on the Football Ontario site and every other minor sports site. And again, I'm not criticizing them. I think it's a great thing that they've got all this on their site and they're taking action to make people aware. But none of these things have made a difference to the incidence and number of concussions. It's not preventing a concussion from occurring. Helmets do not prevent concussions. You need to have a very good helmet. Do not squander on helmet quality, but it's not going to stop a concussion. Neck strength. Neck strength is very important, especially when it comes to football. And definitely younger athletes, especially because of their weak necks, the size of their head versus the rest of their body, they're very much more prone to concussion. But even in dealing with professional athletes, while neck strength is very important to the function of the athlete, it does very little to change the incidence of concussion or prevent them. Mouth guards. Mouth guards can have a minimal impact on concussion so far as what we've seen. But again, the main purpose of a mouth guard is not to prevent a concussion. And regardless how good your mouth guard is, it's not likely going to make a whole lot of difference to preventing a concussion. Vision training. As I said, binocular vision issues. We know that someone with binocular vision issues is more prone to a concussion and more prone to more complicated concussion. So doing something about the vision training will minimize that incidence, but it's minimal. It's a very good idea, as all of these things are a very good idea, but it's not significantly going to change the incidence of concussion. We're not stopping a concussion from happening. And supplements. Again, we'll talk a little bit about supplements. There are some supplements that are a good idea to help in recovery of concussion. And there are some supplements that are showing signs that they might be helpful in mitigating the impact of concussion if taken before the injury. But as of now, there are no human trials to verify that. There are some animal trials. So again, all of these things are very good ideas. All of these things, it's great that they're being implemented, but we're not changing the fact of whether a concussion is actually occurring or not. Secondary prevention. Educating coaches and trainers, making them have greater recognition of an injury and concussion and the fact that something needs to be done about it. Not just like when I played university football and definitely suffered multiple concussions. We did nothing about concussion. It was more of a sign, can you stand up? Can you roughly see how many fingers I'm holding up? Well, get back in the game. Well, we might think of that's a great warrior mentality. And fortunately, that's still thought of sometimes as, especially in football, being a warrior. But it's a stupid idea because it really increases the risk of that athlete to permanent injury and danger. Anyways, coaches and trainer education, increased recognition, extremely important, but it's not preventing concussions from actually occurring. Player education. It's again, very important to educate players on the seriousness of concussion, why they need to pay attention to concussion, and what they needed to do to get better from a concussion. But it's not changing the fact that concussions are going to happen. The only thing that's shown any statistical significance to preventing a concussion is avoiding all contact. Now, so for example, with younger players, maybe focusing on skill and playing flag football is a really good idea. But, and there's a number of reasons for that, so I won't get into that tonight, but eliminating all contact from football, eliminating all contact from sports, no, I don't agree that's a good idea. I definitely think it's a good idea at younger age groups, but in hockey, women's hockey has no contacts. Professionally, men's hockey has contact. There's no difference in the incidence of concussion in the two different sports. Prevention. So if we can't stop a concussion, is there any solution? So what's the solution to this? Well, my point is we're not going to stop them from happening. So the solutions are, what are we going to do to manage them? What's the real problem? What has always been the real problem with concussion? It's management, or more specifically, the mismanagement of concussion. We know that injuries are missed. They're not even reported. And then worse, they're not managed properly. These things lead to complications. These things lead to prolonged recovery or no recovery. So, keys about management. First of all, we need objectivity. And unfortunately, parents and coaches, as much as you care, aren't objective. Athletes are definitely not objective. When I played university football, had a neck fracture for 3 days before I told anyone, because there was no way. I just gained the starting cornerback position. There was no way I was going to give that up because my shoulder hurt. And when I finally went to them, I told them, well, my arm's killing me. I don't know what I did to it. Anyways, athletes, that's not uncommon. That's extremely common with elite athletes. We don't want to come out of the game. More importantly, a concussion is a brain injury. The brain makes judgment calls. How can we ask an injured brain to make a valid judgment call? It's not possible. And it's a ludicrous idea to begin with, to ask the athlete, how you doing? You okay to go back in? Of course they're okay to back in, and that's what they're going to say. So management, key to management. How can we prevent poor outcomes? How can we keep these cases down? How can we make sure all concussions are recovering in 30 days or less, or recovering faster? And when they do recover, when is a safe return to play? When is it actually safe to return to play? So, first of all, prevention of poor outcomes. The most important thing you can do if there's been a concussion is initiate care immediately. Emergency is not initiating care. Emergency, as I talked about, is ensuring that there's not a more serious injury, much more serious than concussion. You need to get your son into a trained healthcare professional who's experienced in managing concussions, because it is a specialized field and it's changing constantly. And if someone's not dealing with that, they're not going to be up to date on what they need to do. Early intervention. Am I just saying this because I'm a clinic and I've got a conflict of interest and I want everyone to come see me? Well, here's what the research says as far as early intervention. JAMA, Neurology, Journal of American Medical Association Neurology in 2020. In this study, athletes who were evaluated within 1 week of injury recovered in a mean of 20 days faster than those athletes seen 2 to 3 weeks post-injury. One reasonable explanation for this is the early initiation of active rehabilitation strategies, including exertion progression and opportunity to start structured physical therapies, vestibular vision, cervical treatment, vision treatment. This resulted in 20 days faster recovery than athletes. So athletes were seen within a week recovered 20 days faster than athletes seen 2 to 3 weeks post-injury. Journal of Neurosurgery and Pediatrics, 2020. Again, the study adds to the literature emphasizing the importance of early clinical care to quicker recovery in concussion. The faster they get treated, the faster they get better. Clinical bottom line, early subsymptom threshold exercise is one of the most important. Not go in a quiet room, stay in the dark, rest, don't do anything. No, actually, subsymptom exercise is one of the most important things to get done and to get started on fast. And when you go into a CCMI clinic, we're going to do a number of tests to determine, first of all, what part of the brain is injured and what things could be done to start speeding up rehab and care. But we're also going to start to determine where that subsymptom threshold level is so we can start rehabbing and exercising safely, get a faster symptom resolution, and a faster and safer return to play. Here's some more research just to go through it. I'm not going to go through each one, but just to point out, there is an abundance of research showing now we need to get them exercising subsymptom as soon as possible. Early intervention and treatment. Rest is out, active rehab is in. And this should start within 7 to 10 days after injury. Manual therapy. As I said, most concussions involve neck pain and whiplash. Exercise therapy, that's to improve blood flow and autonomic nervous system issues, which was one of the primary things that goes wrong in a concussion. And nutrition, reduce inflammation and speed metabolic healing. That's going to involve dietary changes. It's going to involve possibly some supplements. We're starting to realize, and the research is showing, that this is a huge factor in how fast an athlete will get better. Vestibular and vision rehab. With the vision rehab, that ties in with the whiplash because the visual muscles in the eye are coordinated in connection with neck muscles. So we talked about that period of vulnerability where there's energy deficit and a functional vulnerability time period. So here we are. We have the initial concussion. We have a huge drop in energy, and then the brain slowly starts to make its way back to normal brain energy levels. Symptoms typically disappear around this point, 7 to 10 days. If within this period of time, in this period of 2 to 4 weeks, where another injury occurs, so they feel great, Johnny feels great. Johnny, you want to go back to play? Absolutely, I want to go back to play. I feel great. I feel 100%, no symptoms, no whatsoever. He feels great. Send him back. He's good to go. If he gets injured in this period of time before his brain has normalized its function, he's going to have a more severe concussive reaction, including one that can start to go to a level of causing cellular death. And this first one, very rarely is it ever going to result in any permanent cell damage or brain damage. But if you get hit here, that's where the potential for brain damage is going to start to occur. And the recovery period could last 3 to 4 months or a year. So here's one thing I'll point out to him. Get him back to what? Play an extra game, and he's going to miss his school year because he can't function. It's not worth it. It needs to be taught and promoted within all minor sports. This needs to be addressed. We cannot rely on symptoms as a measurement for whether an athlete is ready to get back. And again, if they get hit again, cumulative. So the point of this is, and this is what's happened in past with professional athletes, is each concussion, if another concussion is occurring before the first concussion is resolved, the effects are cumulative, and a minor brain injury can lead into a severe brain injury, and severe brain injuries carry heavy consequences, permanent disability, and even death. That's the whole point of this Rowan's Law. A young girl with a cumulative trauma, injury, and concussion, and she died. So a cumulative effect, mild traumatic brain injury, can then turn into severe. At the very least, it's going to be a more complicated recovery. Whose opinion is this, that it's people are returning to sport too soon? Again, this is coming out abundantly in the research. Strong data reinforces a public health concern. This is neurobiology disorders. 2014 reinforces the public health concern that too rapid a return to activity after traumatic brain injury can cause permanent brain damage and disability. This is the International Consensus Statement on Concussion in Sport. This was 2017, the most recent one. There was supposed to be another one in 2020, but because of the pandemic, it was delayed. I believe it's coming out this year. But this is where all the top scientists and researchers in the world on the topic of concussion come together and go through research, go through clinical protocols and data, and establish up-to-date clinical protocols and data about what should be done in the best way to manage concussion. Recent literature from that suggests that the physiological time of recovery may outlast the clinical recovery. So the consequence of this, athletes may be exposed to additional risks. So in other words, a physiological time of recovery, so feeling better, I feel normal, the physiological time, the brain getting back to normal may outlast the time of clinical recovery. In other words, I'm symptom-free, I feel great, I feel normal, I'm 100%. No, what research is showing, it's very rarely that they're 100%. So we can't prevent concussions from happening, but we can prevent them from turning bad. How can we get a safe return? How can we not only make sure they recover faster, but how can we know it's safe to send them back into the game? Well, we talked about this functional vulnerability and symptoms. Okay, I think I've explained this well and the dangers with it. Symptoms. We cannot rely on symptoms. And we can't rely on normative data when it comes to evaluating brain function. Your son, whether he's the Einstein in the class or the clown of the class, his brain function, it doesn't correlate. So it's important to establish what he was like before the injury. How do we establish a functional objective evaluation for a safe return to play if these things are not good? How do you know what or where you're trying to get back to if you don't know where you started from? Baseline testing. So what is a baseline test? It's a procedure. It's not a test. No one single test is effective on its own. Not impact test, not Dana test, not any test is effective all by itself. What the research is showing is that multimodal testing is critical. In other words, a battery of tests should be done as a baseline pre-injury to determine function. Testing various areas of brain function, cognitively and physically. These tests have to have good test-retest reliability for a minimum of 6 months to a year. They have to have good longevity after injury. In other words, they need to be able to show subtle dysfunctions even after the symptoms have gone away. Some tests are very reliable that a concussion has happened and there's dysfunction within the first week, but then they're unreliable in telling us if there's any functional problems after the symptoms have gone. So the purpose of a baseline test, just to emphasize, is not to diagnose a concussion. As I said, all you need is a mechanism of injury and symptom. Now, it can be useful if we have a baseline test or helpful to diagnose and differentiate between a neck injury or head injury, but it's not essential to diagnosis. And yes, that probably means that we're going to overdiagnose concussion, especially without a baseline. But again, the consequence of underdiagnosing it is much more dire than the consequences of missing some extra games. The primary purpose of baseline test is for assisting in making a safe return to play decision, an objective return to play decision, to actually know, is he functioning the way, brain-wise, is he functioning the way he was before he got injured? Now, why isn't baseline testing common and fundamental across all minor sports in Canada? Well, I don't want to get into really too much the politics, but I think it's worth stating because there's a lot of associations, parents, and teams that still think baseline testing isn't necessary. There's an organization in Canada called Parachute Canada, and they made a statement back in 2018 that the baseline testing was not necessary and not needed. And unfortunately, they were commissioned by the government to establish what was necessary to do or not do in concussion management. And they established it wasn't necessary to do baseline testing. And that's perpetuated across all minor sports across Canada. And we're slowly trying to break that down. Primarily because if you look at every single other international organization in every country around the world, they all say the same thing: baseline testing. The International Consensus on Statement on Concussion in Sport, that's all the top people in the field of concussion in the entire world, baseline test. Concussion in Sport in Australia, their statement 2019, baseline test. The Canadian Olympic and Paralympic concussion guidelines, baseline test. Centers for Disease Control, baseline test. The NCAA, baseline test. Baseline test. The North American Trainers Association, baseline test. The Ontario Neurotrauma Foundation guidelines for diagnosing and managing pediatric concussions, baseline test. The proceedings from the International Ice Hockey Summit 2019, baseline test. If you're a professional umpire, you can't walk on the field without a baseline test. If you're in professional sports, most professional sports teams baseline test. It's not mandatory. It's not mandatory because all professional athletes, especially in North America, have a union contract. It's illegal for a team to make something mandatory that's not already in a collective bargaining agreement. That doesn't mean that most teams don't baseline test. They do. Most of them, a lot of them do. But it's not every single athlete because it's still a choice because of the collective bargaining agreement. But the bottom line is most centers, most sports, professional especially in high-level sports, Olympians, NCAA, professional, baseline test. Why aren't amateur athletes and kids baseline testing? Our baseline test in CCMI is a multimodal, faceted barrage of testing, taking concussion and medical history, symptom scores. It's important to know what's normal symptoms for an athlete. You know, does your son typically get tension headaches on a regular basis? Well, it's important to determine what was his normal headache versus what's the headache he has now, right? It's very different. Take a look at orientation, auditory memory, concentration, visual tracking and processing speed, balance, neurotracker, which measures executive function, reaction time, binocular vision screening, delayed recall, impact test. Although impact test is not valid for kids under 12, and Dana neurocognitive testing, which is now the primary neurocognitive test used by the US military. So again, one organization and the rest of the world says baseline testing. What really is the evidence for multimodal baseline testing? I'll send everyone out a review of what we do in baseline testing with references, right? There's more than a couple references in the published scientific literature that supports baseline testing. There's 45 different published studies validating the importance of baseline testing. Find out where their pre-injury status was before anything happens. Then when a concussive event happens, one, we can really conclude whether it's a concussion or just a neck injury. So that's a benefit. Second of all, now we have a way to know if we're out of this period of vulnerability before we allow them to get back to full play. So we prevent them from getting a secondary cumulative concussion. And the thing about it is, I know this is not football, but if you remember Sidney Crosby, when he missed almost 2 years of his career, the second hit that put him out for 2 years was a regular hockey hit that he gives out harder hits than that on a regular basis. But he hadn't recovered from his first injury yet. Now, because we're dealing with football, many of you may remember this movie. I think it's a great movie, and it brought a lot of awareness to concussion. But I think it put the fear of a lot of people into playing any contact sport, never mind football, because of CTE. Well, since then, a lot of research has been done and more is happening. Admittedly, this is an ever-growing field, but currently the research shows that when they looked at this was the statement that came out by CNN around the same time as this. 99% of studied brains from decreased NFL players show concussion. Well, yes, in the brains that they had, but that's not 99% of NFL players. That's in the ones that they had involved in here from this, that they highlighted in this movie. It's a very different statement. It's a very attention-grabbing statement, but it's a misleading statement. Research now shows that there is no higher incidence of CTE in football players, retired football players, than there is in the normal population, including the normal population that's never had a concussion. This study looking at former NHL players in relationship to ex-NHL players in relationship to normal population. No significant cognitive impairment, regardless of how many concussions they've suffered. So they didn't show CTE occurring. The study went on to talk about the fact that there was definitely anxiety and angst associated with their belief that they might have brain damage or problems from their concussions. We won't go into that tonight, but most of those problems that occur with post-concussion syndrome are not because of actual brain damage, but because of dysfunction that occurs in the sensory input going into the brain that's not normalized because they weren't rehabbed properly. Those are the problems that exist then in those 30 to 40% of people who don't resolve. The bottom line is there is no statistical difference between contact and non-contact sport athletes. So you don't have to panic or worry about that your son's playing football and therefore he's going to end up with CTE. What you have to make sure of is that concussion is a serious injury and it needs to be paid attention to. It needs to be managed as effectively as we know how. And that's changing on a regular basis too. We're becoming more effective at it. We're learning, and maybe one day there will be a very effective test to tell us definitively. But right now there's not. So it's important to baseline test. And it's important to get active care and make sure there's a safe return to play. I talked a little bit about prevention through visual training, binocular vision. Now, depending on the level of binocular vision, you might actually need more intense visual rehab. But one of the things I incorporate in my clinic is, as far as a prevention strategy, but also as a rehab strategy, is something called NeuroTracker. Now, this is used in functional performance with a number of professional teams. But one thing I'll point out is the Navy SEALs have been using this for now close to 20 years. It was developed out of the University of McGill to look at severe brain damage and severe brain injury, dementia, and the aging brain. And unlike other online games, crossword puzzles, things like that, this has research and MRI studies behind showing changes in improvement in brain function. So it can increase visual processing speed. It can increase peripheral vision, which can be potential benefits in not only performance in sport, but the wider your vision is, the quicker you're going to see someone coming at you. How does NeuroTracker work? You basically work with a visual 3D screen, and you track balls over a certain speed and time. It's very rudimentary, very basic, but basically 30 minutes, 2 to 3 times a week, can create a significant difference as far as something you can functionally train to make the brain process information visually faster. And the great thing about it now is, while we do a baseline inside the clinic, we can actually make this cloud-based, and so we can send you home and you can do it out of your home. Finally, the last thing I want to mention is the Concussion Tracker app, which is available through all CCMI clinics. This app is free. It's free to individuals, so families. It's free to teams, and it's free to organizations. It allows communication between a clinic, the doctor treating, the parents, the coach, and the trainer. It allows us to track symptom updates, both the trainer who maybe did an assessment on the field. It has recovery diet plans within, so we can communicate and educate the athletes using it. It allows us to track and keep parents, coaches informed as far as where they're at in return to play protocols. So the key is its communication ability. It has a list of licensed clinics. So if you're not in Mississauga next to my clinic, and you're in, say, London, or you're in downtown Toronto, it's got a list of CCMI clinics, and you can pick a clinic close to you. It has a sideline assessment, so we make it available, and we actually have a sideline program free for coaches and trainers to take, so that you can use the app to do a quick SCAT sideline assessment. That's going to then be recorded in that patient's file. So when they go into a clinic, we're going to have immediate information about what was going on the sideline when we're doing the assessment. So we can monitor any suspected confirmed concussions, confirm it with the team. We can confirm when they're clear to practice or what level they're at to go back to practice. And we can confirm when they're cleared or not cleared to play. We've also added a new feature in that, like, one test on its own is not itself baseline, but at the very least, they can do a free neurocognitive test, the Dana test, which, as I said, is the test now used by the US military. So at least there's something done to get started. Beyond that, I think it's actually critical to get into a CCMI clinic and get a baseline properly done. But all that is then tracked. Our baselines are tracked and kept within the app. So let's say your son goes off to school or in a tournament somewhere, or somewhere away from home. They can go into a close by CCMI clinic, whether they're in Houston, Texas, or whether they're in Toronto, or whether they're in Montreal, and they're immediately going to have access to their baseline data. So when they do a test, when they do an evaluation and exam on them, they can know right away comparatively to their baseline. So the key for complete concussion management is, one, the Concussion Tracker app. It's a great communication tool, and it's a free tool. All you got to do is to go to the Google Play Store or your Apple App Store, and it's a free download. Parents, if you got multiple athletes in your family, you as a parent can download the app, register your family as a family as opposed to an individual, and then you're going to have immediate access to all your athletes and where they're at. And then each of your athletes will have it on their phone. Provides some basic baseline testing, but also communication of all the baseline tests done within a clinic, kept within the app. It allows us to communicate. Well, the app does, but also then within the clinic, we do the baseline testing, concussion treatment, and we're doing the most up-to-date protocols. And we're constantly changing, keeping that up to date because we have a whole team that follows and keeps up to date on the literature and then informs all the rest of the clinicians. So there's a constant communication between clinicians, including continuing education requirements that each of the clinicians has to keep up to date on a regular basis as far as what the current protocols are and what the current protocols aren't. Providing concussion awareness and education. So I'm hopeful that we provide you valuable information tonight, and I encourage you, pass this along to other parents. Return to work, return to play protocols, making sure that kids are getting back to play safely or back to school. Organizations, we provide free tools within the app and tools as a clinic that you can apply with regards to your concussion program and policy developments. And then the network, which provides you a list of multiple clinics across North America that you can have readily access to a basic and standardized form of care in concussion. And as I said, we have a free coach and trainer education program, online program. I believe it's 6 hours. And actually, we also encourage parents, take that same thing as the coach and the trainer. It's free. So in summary, we cannot really prevent a concussion from happening, right? Other than avoiding contact, and that just minimizes it. But we can prevent more serious secondary injuries with proper management, baseline testing, and evidence-based return to play strategies. And we can prevent a prolonged outcome by initiating early care and rehab. So next steps, schedule a baseline. Get your son baseline tested. Don't let them go in the field without one. Download the concussion tracker app. It's free. Email me with any questions. I'll have a question and answer period now, but if that's not addressed or you need to go because we're reaching our time limit now, but email me with any questions, sorry. And if you'd like to receive monthly education information about concussion, again, email me and I'll be happy to include you in that list. Okay, so now we open to questions.